Atherosclerosis and arteriosclerosis are not the same thing. They're definitely very often used interchangeably, but understand that arteriosclerosis is an umbrella term, while atherosclerosis is a type of arteriosclerosis. The definition of arteriosclerosis. It literally stands for the hardening of the arteries. Arteries should have some sort of flexibility, but within certain medical conditions and diets, they start to get stiffer and they harden up. And that is a bad thing because that means there's less movement of oxygen and nutrients and other things that would normally be transported through flexible walls of the artery. Arteriosclerosis is just the idea of the arteries getting more stiff. There are types of arteriosclerosis. So arteriosclerosis is the overarching idea of the hardening of arteries. And then we have certain types of arteriosclerosis that contain different reasons for the hardening of these arteries. And this is where atherosclerosis comes in. Of the three types, atherosclerosis is the most common type of arteriosclerosis. It's so common that it's pretty much, again, used interchangeably. With all three, again, they are all the hardening of those arteries, but let's talk about what makes each type a little bit different. Atherosclerosis is specifically the hardening of the arteries caused by plaque buildup. So what is plaque made of? Well, things like fat, cholesterol, and other substances. Causes of atherosclerosis include having high cholesterol, diabetes, a fatty diet, smoking, among other things. Now, regardless of what causes it, if a person has plaque evident in their arteries, it's called atherosclerosis, which is, again, a type of arteriosclerosis. Atherosclerosis also affects the large arteries of the body. Arteriolosclerosis. Unlike atherosclerosis, this one does not affect the large arteries. In fact, it's specifically the hardening of the small arteries in our body, so the arterioles. So think about arterioles, capillaries, venules, so the super tiny arteries of our body. This does not need to be caused by plaque buildup. It's just the presence of the hardening of arterioles for whatever reason. Now this one is the hardening of the arterial walls via calcium buildup, and it can happen in any sized artery, although it mostly occurs in small as well as medium-sized vessels. It's as simple as that. If you're studying for the NPTE, whether you're a PT or PTA student, check out our courses at sptwithme.com.